Now we are moving on the internal structure. Internal structure of cerebellum. So moving on, it is divided outer gray matter and inner white matter. And it has cerebral cortex, and it is known as outer gray matter is cerebral cortex, cerebellar cortex, and cerebral cortex have three layer. These are molecular layer, then Purkinje cell layer, then the last one is granular layer. In the molecular there is few neurons like satellite. There is satellite basket cells are present, but in the Purkinje cell there is one in the row there is Purkinje cells, and in the granular layer there is dense packed granular cells. We can look in this image. It is cerebral cortex. This one there is a molecular. This is molecular. After that Purkinje, and then there is a granular layer. And we can look in the molecular. There is the molecular region. There is a stellate cell, and there is the basket cell and stellate cell. And when we look the Purkinje layer, this is Purkinje layer. In the Purkinje layer there is a Purkinje cells are present. In the granular there is a dense granular cell are present, and there is also Golgi cell. So moving on, white matter. In the white matter deep to the cortex, is present deep to the cortex. So this is the white matter. These are the white matters. So in the white matter contain arbor vitae. It means there is a tree-like branching of white matter. And there is deep nuclei. So memorizing for deep nuclei, there is deep cerebral nuclei. So for medial to lateral, there is a mnemonics known as this mnemonics is don't eat greasy food. So when we apply these mnemonics, D for dentate nucleus, dentate nucleus. Then E for emboliform, nucleus, nucleus. Then G for globose, nucleus. Then F for fastigial nucleus, So these nucleus present in the deep or white matter. So we looking in this image. So medial to the lateral. So this image, medial to lateral. So there is the dentate nucleus. This is dentate nucleus. Then emboliform nucleus. Then globose nucleus. Then fastigial nucleus. These are nucleus present in the deep white matter or deep surface in the deep, and it is a transverse section. You can look, and this is the cortex region. And moving on, and this is fourth ventricle, and this is pons. So moving on the peduncles, there is connection between this is hindbrain, pons, medulla, and then spinal cord, and behind that there is a cerebellum. So from midbrain to the cerebellum, from pons to the cerebellum, and from medulla to the cerebellum, there is some 5 nerve fibers, and this nerve fibers bundle is known as peduncles. So from the midbrain to the cerebellum is called superior peduncle. From the pons to the cerebellum is called middle peduncle. From medulla oblongata to the cerebellum is inferior peduncles. And so we can look in this image also. In this image we can look, this is superior peduncle, this is inferior peduncle, and this is middle peduncle. So and that are connecting to the cerebellum. And also I want to mention these things. These nuclei are all cells. When we look for these all cells, satellite cell, granular cell, Golgi cell, these are the intrinsic cell. Intrinsic neuron present in the cerebellum. Now we have covered up peduncles also. Moving on, some fibers. There are some fibers coming from inferior cerebellum peduncle, some fiber comes from the middle peduncles and cerebral peduncles, and some coming from the superior peduncles. So now moving on the fibers, what are coming in the cerebellum. So when we focus, there is a corticopontine cerebral pathway, and this pathway, like, it's come from the cortical region of the cerebellum, and it's go into the pontine nucleus in the pons, and after that there is a fiber going to the opposite side of the nucleus through the middle peduncles. This is peduncles. And also we look, there is this pathway is known as cortico-pontine cerebral pathway. Information going from cortex to the cerebral cortex of the cerebrum to the pontine, and pontine nucleus transmit into the cerebellum. Then another one, the cortico-reticular cerebral pathway. In this pathway, from the information from the cortex region of the brain of the cerebrum, and is going to the pass through the reticular formation nucleus, reticular formation, and then there is passing the nerves. The nerve is into the same side ipsilaterally in the cerebellum through the middle and inferior. And another one is cortico-olivary cerebral pathway. And cortico-olivary, from the cortex to the inferior olivary nucleus, go information from the inferior olivary nucleus, and from that go contralateral on the side of the cerebellum through the inferior cerebellum peduncles. And these are from the cerebrum to cerebellum connection. Cerebellum information going. And when we look, these are afferent for the cerebellum. When we look for the spinal cord to cerebellum. So there is some pathway. That pathway are anterior spinocerebral tract, and from the opposite side of the body, the nerve fiber come and passes through the another side or contralateral, and it's go from the superior peduncle and give some fibers to the opposite side of the cerebellum, and it's go opposite side of the cerebellum. So it's control the ipsilateral, so that it passes through the where from the information come. It's come from the left to go in the left cerebellum. Information coming from the left body part to the go into the also left cerebellum. And another one is posterior spinocerebral tract. Posterior spinocerebral tract, the information coming in the same side to the go ipsilaterally and go inside the cerebellum by the inferior cerebral peduncles. And another is the vestibular nerve. And vestibular nerve give the information to the vestibular nuclei, and vestibular nuclei passes the information, some nerve fiber through the inferior cerebral peduncles. And also there is the nucleus cuneatus. This is for the cunocerebral tract, and the information from the cunocerebral tract to go inside the cerebellum by the inferior cerebral peduncles. So more and from the nucleus cuneatus, it's directly connection with the dentus nucleus. Now moving on the summary part of this afferent cerebellum pathway. So there is the pathway cortico-pontine cerebral from the higher central or cerebrum, from the cerebellum. Cerebro-olivo-cerebral is also from the cerebrum, and cortico-cerebro-reticular cerebro-reticulo-cerebral path tract also. And there is from the spinal, and this is from the cerebrum. And these are the anterior spinocerebral, posterior spinocerebral, and cunocerebral. And there is the vestibular from the ear or vestibular apparatus. Function of these, they are convey the control from the cerebral cortex cerebral cortex from the cerebrum, and anterior spinal cerebral and posterior spinal cerebral convey from the information from the muscle and joint from the our body position, and cunocerebral convey the information from the upper limb mainly. Cunocerebral from the upper limb mainly, and vestibular from the head position or movement of the body, movement of the heads and position. So there is origin we have also already discussed. So this cerebrum, there is its are from frontoparental and temporal occipital lobes of the cortex region, and also for the reticulocerebral, these are from the somosensory motor area, sensory motor area. And regarding the anterior spinal cerebral, it's are from the muscle, spinal tendon, organ of the receptor and joints, and also same as the posterior, but the cunocerebral mostly from the spine, tendon and organ of the receptor of the upper limb. And we know regarding the lower limb is gracilis. So there is no gracilis nucleus connection, so the cunocerebral information. And regarding the vestibular, the uticular, saccular and semicircular canal, the information give to the vestibular nuclei, and vestibular nuclei then give to the our cerebellum. And there is other also like red nucleus tectum that give the information, convey the information from the midbrain. And destination at the we have discussed in the image based. So moving on, efferent. So regarding these are the efferent fibers. So they are the connection from this deep cerebral nuclei to the another connection of the brain or spinal cord. So moving on, that there is dendrothalamic pathway from the dentine nucleus to the thalamus, and thalamus connection between the cerebral cortex. And another one is there is the direct connection of the red nucleus to the dentine nucleus or the deep nucleus. So that is known as globulo-imboliform rubral pathway. Globulo-imboliform rubral pathway. And there is some connection of the like left hemisphere to the right hemisphere. And there is a fiber from the vestibular pathway, which is deep nucleus to the cerebral cortex. And there is also this fiber come in the vestibular nuclei, and from the vestibular nuclei there is a vestibular spinal nerve, and then also there is a connection of the vestibular nuclei to the cerebral cortex, and these are giving the information. And there is also the vestigial reticular pathway, which connection between the reticular formation with the cerebellum, and it's controlling the cerebellum from the cerebellum, the reticulospinal nerve, spinal tracts. These are the some tracts. So we have the summary chart. So in the summary chart there is a globose embolism from rubral tract. Its origin from the globose nucleus and imboliform nuclei in the cerebellum, and its destination is to the contralateral red nucleus, contralateral to both sides of the red nucleus, and then by the cross the rubrospinal tract and ipsilaterally motor neuron and the spinal cord. And regarding the dendrothalamic, it's originates from its dentate nucleus and to the contralateral ventrolateral nucleus of the thalamus, and then its contralateral motor cerebral cortex passes through the and from the corticospinal tract and crosses the midline and control the ipsilateral motor neuron of the spinal cord. Regarding vestigial vestibular and also the vestigial reticular, these vestigial nucleus to the vestibular. So vestigial nucleus give the connection to the vestibular nuclei, and then this vestibular nuclei lead to a tract, vestibular spinal tract, and that control the ipsilateral motor neuron of the spinal cord. And also regarding the vestigial nucleus, it's originated from the vestigial reticular originated from the vestigial nucleus and connection between the reticular formation, and then it's from the reticular spinal tract and the spinal tract ipsilaterally control the uh,